Well, hello, everybody. This is Dr. Bill Williams, and we are talking Redox Dentistry today. We're going to talk about the enhanced patient care and healing that occurs with redox signaling. If you want to get in touch with me, you may. I'll be glad to talk with anybody offline. Now, that's my URL for contact. You can get a phone number and you can get information about what we're talking about today, the details of redox dentistry. Also, you've got a phone number you can text me and ask to get a call. So thank you so much for being on the program today. We're going to jump right into the outline of what we're going to be covering related to redox dentistry. Of course, you want to know where we are today with this. What is the oral systemic promise that goes along with it? How is it going to affect us in our practice, our own health, our own bodies? What are the redox signaling molecules? What's the science behind redox? How does it help in dentistry? What's the medical impact? Your health impact is the biggest reason to be listening to this today, by the way, because it's so much more important than a lot of the small things that happen to us. This is big. So connect the dots as you go through this and you'll see. Why is it all important? Well, we're talking genes, we're talking about DNA, we're talking about epigenetics, things that are important to our life, health, our aging process. And because 54 million of us suffer from inflammatory conditions, we're going to be able to help those people. 1 in 3 Americans have a heart cardiovascular disease. They don't even know it. Matter of fact, I had a cardiac treatment just this last week that I picked up in a screening event that was called Arterial flutter and had no ill effects, but they picked it up and were able to solve the problem within just a couple of hours. It is an amazing thing what we have in our medical institutions today. So you never know. You need to know that it's common and that it can be treated and prevented. 57% of the population has digestive disorders. 80% of women suffer from some kind of hormone imbalance, probably just as many men. I know there's so many things out there that we don't know until we test. And so this is a very significant lecture for many of you because we're going to be talking about testing. We're going to be talking about supplementation that can alleviate many of the problems that we're going to be showing you today. Supplements that are totally non-toxic, natural to the body. So what I want to tell you is this. If you don't know why you're here, this page will tell you there are 5 emerging technologies in science that would change and shape your life in the coming years, said an article in the Huffington Post. They talked about organic electronics, nutrigenomics, synthetic biology, redox signaling technology, and neuromorphic engineering. One of those is the topic of our technical study today. And this is something that we have brought to dentistry. Dr. Lee Osler and I have been promoting this for now a year and a half to the dental profession. And we've done numerous lectures all around the world on this topic. And what we're finding is that the dental profession is latching onto it. And in your practice, in your home life, it's very important to be aware of these for the potential benefit of yourself, your family, and your patients. So what is it? What does it do? Why do you need it? The foremost authority on nutrition, a lady named Louise Gilman. She's been known for 30 years writing books. She's probably written over 20, 25 books on nutrition. The latest being Radical Metabolism, a powerful new plan to blast fat and reignite your energy in just 21 days. In this book, she highlights redox signaling molecules as one of the techniques that you need to employ. And as a matter of fact, she found it so important. She said, in my humble estimation, it's the greatest advance in lifestyle medicine, which harnesses the power of your own body to keep you well. She went back and rewrote the books that she had written in the past decade to update them to include redox signaling molecules as an essential supplement. I mean, this is the foremost authority in America writing and going back and reworking, updating her own words to be up to date with what's going on. So you should pay attention. The guy who invented it is Gary Samuelson, an atomic medical physicist, and he said this technology has the potential to spearhead the greatest advances in health we have ever seen. What, in your case, worries you the most? If you're sitting there thinking, as you're listening to this lecture, are you thinking, well, I'm more worried about my health, how I feel, what disease processes I have? Or maybe you're sitting there, you don't feel anything too bad. You say, well, I'm looking at myself in the mirror going, I don't know. I'm getting older. I'm aging. I don't have the beauty I want. Maybe it's both. This lecture is going to answer two questions. Both of these are at the central core of that question. But really, how are you feeling? All these problems, every event or condition on this page indicates a need for treatment by increasing the free radical activity. That means you need to get rid of the free radicals that are acting on your body, the toxic free radicals. So look at low energy level, can't concentrate, irritable, nervous, tired at night, sad, anxiety, rough, scaly skin, bruise easily, tension headaches, feel tense, poor hair texture, and on, mood swings throughout the day, not alert. So if you take a survey of people, find out what they have, and then you address these free radical activity issues, you can change all that. You can change the way people feel, the way they are. So that's something that we're going to dig into. How did I find out about Redox? Well, Stephanie, Dr. Osler's wife, had a unique story of success taking this particular supplement. And she, in just like 2 days, 3 days, could tell a huge difference in the way she felt. She had been bedridden for 30 years. She had significant medical issues. Things like photophobia, couldn't go outside, bright sunlight hurt her eyes. Things like depression, things like issues that were just medically not treatable. You know, she had been diagnosed with something that gave her seizures, and they didn't know exactly how to get rid of them. And so Lee, through the medical physician that she was going to, found out about this Redox and said he was going to try it. He looked it up, studied it, went through the science on PubMed, and said, this is worth a try. He did it. She got better, much, much better. And so Lee texted me after it happened and said, I need to talk to you. So he called me up and we talked for a long time. And I said, you know, this sounds unreal. It's so amazing what you've just shared with me. So I'm going to look into it. And that's how I found out about it back in October of 2018. So what I want to tell you is that redox signaling molecules, when she found them and started taking them, it changed her life. She was able to get outside. She was able to, you know, view the world without dark glasses on. She was able to walk instead of fall down because she had an unsteady gait. So, you know, she basically said, I realize I'm here now. I'm a real person. And Lee said, I have my wife back. And he's, you know, had a problem. And I've known him for 35 years, so I know exactly what she's talking about. Because we're discussing drugs here, we're not discussing drugs here, we're talking supplements. So it's something I should tell you that the FDA requires that we make a statement regarding dietary supplements that have not been evaluated by the FDA and are not intended to diagnose, treat, cure, or prevent any disease or health condition. That's how it is with every supplement. And so we know they're going to make you better, but we don't have any scientific studies because we're not allowed to do that and announce that. So how did I get started in all this? You know, Dunkin' Donuts, 1967, sitting at the counter talking to my dad, and he said, "You want to be a doctor?" Yeah, I think that's what I've narrowed it down to, from a physician to a dentist, veterinarian. He was a veterinarian, and we kind of did the Ben Franklin balance sheet about which is the best thing to do, to be in what profession. And so we kind of looked at all the things that were on the table, and I go, well, I think I'll be a dentist. And I'm glad I did. He passed away at age 88 from COPD. But I believe if he had had the Redox and had really been taking it for a long time, he would have lived to at least 98 or longer. And I really enjoy the thought that I wish he could have stayed around 10 more years to meet his grandchildren, our two boys and our girl. So one of the things that is important is that we get our blessings and we count them. You know, I had a great start in dentistry back in '76, and for the first 5 years, we built up a great team and traveled together and went out to Quest and did some team training. Built a nice building, had 12 operatories back in 1985. This building, and we call it the Stone Mountain Dental Group. Used to teach in there, TMJ and orthodontics, and had a lot of fun. But you know, everything that goes up does come down. And so there was a turning of the neighborhood prime, and people started moving out, and it was just a problem. When people were actually killed on our street corner that I lived and practiced on there, I decided, you know, I'm moving too. So we sold the practice, and the guy that I sold it to gave it back because he couldn't afford to keep it. So I had to go back in and rejuvenate the practice, and I had to start the practice up again. It took me a couple more years to sell it for the second time. And so I got out to the point where I was just going to start a new practice, and then the stock market fell and everything went to heck. And then as we kept going, I didn't give up though. At age 48, I started over again, and I went to a small town north of Atlanta called Suwanee. And, you know, I was surrounded by trees and not much else at that time, but it kept growing, and we were able to build our practice and do well. And that was 22 years ago. So I practiced in Stone Mountain for 23 years, and I practiced here in Suwanee for 22 years now. So I wrote a book called Marketing the $1 Million Practice based on how we built our practice and grew it from zero to over $5 million in that 10-year period that we were there, the first 10 years. So it's a good story, but you know, just because you move to a new place doesn't mean all the problems go away. And this happened to us just last year, back in November of 2018, a year and a half ago. And car drove right into our reception room. So every good thing always has followed up by something that's not so good. So, you know, I just want to show you that you can always overcome anything, though. It's not always the worst day. This period we're in right now is the COVID-19 era. We're all off of work right now. And that's not the worst thing that's going to ever happen to you, but it's not a good thing. It's pretty tough. So we're going to get through this one too. But I've been through a lot. I've been through the stock market problems, the 21% interest rates. I've been through .com bust. I've been through neighborhood changes. So this too will pass. But here's a message to everybody. There's more to life than dentistry. You know, it's your grandkids, it's your friends, it's your travels, it's your recreation, it's your faith. And mission work is a big thing for me. So when I go down to Marijo, Kenya, I started in 2001 with my first trip. And this is my first patient in Marijo that I ran across up there in the top right. It's Tabula and her tumor on the side of her jaw. And so we kind of got together and took up a collection and sent her to the hospital because we weren't going to try to remove that tumor out in the field with no suction and no electricity, of course. So we got her fixed up in 2002. You can see we got a great looking result. And then we went back another year and her friend showed up. She had one too. So everybody was coming to us that had all these tumors. Well, one of the things that really impressed me was how they let us know that when we came back for the second time, we thought we were just doing nothing much good for the community. We were doing a mission thing, but we thought, well, you know, it's just, what's a drop in a bucket when you got so much need, and we're just doing a little bit for a week or two. Well, it turned out they had a commissioner there that met with us for the district commission, you know, and he said, you guys don't know what good you've done for this group of people that you've gone to see up in the mountains away from everybody. They don't have, you know, any hope. Now you've given them hope because you kept coming back. you know, our own people don't serve these remote villages, and you came back all the way from United States to serve them for the second time. And so that was the message we got on our second visit to Kenya, to Omakinu and Marijo. So we ended up building a hospital there. We ended up working and staying there for 10 years, going back and forth every year. And it's a joy to work with the people, you know, and you'll get all kind of things given to you when you go on missions. I'm telling you, I got a goat one year for the lady that had the second tumor. She came back and gave me a goat the year after she got her tumor removed at the hospital, same as the other lady. And I have a goat somewhere in Kenya growing up. You know, you don't go just to Kenya, you go to Central America, and we went to Honduras a couple of times. And when we did go back to Kenya, we had noticed that this lady that got her tumor removed only had half of it removed the first time. It was so large. So we paid again for her to go back to the hospital. Took a while to get her in, but they ended up getting the rest of that tumor out of her mouth. And the second half took away most of her palate on the left side of her face. So there was an obturator denture made that fit in that space, and she was able to breathe and eat without the air going through with that obturator denture in there. So it's a very rewarding thing to be associated with something like that. And mission work is something we've always believed in, and just got back from Vietnam Christmas of 2018, and we were able to do our first lecture actually in Hanoi and Da Nang, Vietnam, on RedoxDentistry of all things. They were some of the first people to hear about it from our standpoint and the dental standpoint. So even though it was mission to do dental work, I got to do lecturing to the medical students in Hanoi. Now, we don't do just international missions, and there's more to it than just that. So a lot of times people say, why are you giving away all of that stuff to the people over there when you're not helping the people over here? And it's like, well, you don't know, but we are helping people over here. And we have a thing called the Deserving Diva Makeovers, which is actually a local mission to help people that are deserving and needy. We've worked with the Give Back a Smile program for the American Academy of Cosmetic Dentistry. So we've done a lot of things that are local, but I just wanted to highlight that wherever you give, you just need to be a giver. You need to learn the law of reciprocity, because I always felt like this: you can't give from empty pockets. You can't be successful in your life and then keep it all. You got to give away a portion of what you earn, and God rewards that when you do, right? Now, if you want to take care of other people, you got to take care of yourself first. So that's one of the tenets we have, is you've got to be profitable before you can be generous and give away things. So we always say to really be successful, you got to fully engage in your big mission in life, and then things are going to flow towards you. You know, it's the law of attraction. If you want to learn to rebuild mouths like this, I mean, this is a pretty bad off mouth, right? And you need to bring hope to these people. These are not people that were in the mission field in Africa. This is somebody who showed up at my office right here in Atlanta, Georgia. This is just a local person here in Atlanta. So poverty and money are not always the reason for neglect. This guy had more money than any of us can count. What I'm saying is, it was fear, it was neglect, it was a lot of things. But if you'll take on these kind of folks and treat them right, then they will help build your practice. And I'm showing you this particular case because it was one of my first cases I started using the RedoxDentistry concepts with him. And I got so amazing healing from these early cases that it really caught my attention, and I started to teach other dentists and other hygienists and other dental assistants how to use it in their offices. So as an aid to healing and post-op discomfort, when we were doing these big cases, we would load them up on a pre-op protocol to start taking redox signaling molecules. You know, this is new technology. It's not something that's been done. Any dentist in the country, I would say, has been doing it much. It's very rare because dentists just never knew about it. I just found out about it, like I say, at the end of 2018, and I've been lecturing on it ever since. This molecule turns on 5 genetic pathways that we know of because we've studied it. We've got research, which I'll show you in a little bit. So it reduces the inflammation pathway. That's huge. I'll try to explain that a little more in detail later. There's an immune system pathway that's big as far as improving your immune system, and everybody knows that that's important right now, especially. Vascular health signaling pathways are improved. Digestive enzyme signaling pathways are improved. Hormone modulation is improved. And so I got personal experience on all these. I've seen it, I've experienced it, and I had hormone levels that were too low. Now they're normal. I've got friends with digestive problems that have gone away from just taking this redox signaling. They don't have GERD. They don't have things that they used to have. Vascular health is improved, and you'll have tons of blood markers that get better. Total cholesterol, HDL, LDL, triglycerides, HbA1c test, C-reactive protein, totally different. Now, when I started taking this, it all went better to normal. So I just want to tell you, things do happen. When you do, they look better too. I mean, this is the guy that you saw before that had all those implants and all that surgery for all that caries. And he's happy. He's referring patients. He's technically a healthy, happy person now. And it's what the science of dentistry can offer people. You know, it's not just your technical ability, it's the science behind it, the implantology, the redox signaling technology, all that goes together. So who is this for, this type of redox system? Well, it's for 3 types of people. Those who want better performance in their body, athletic performance, endurance, people that want better health in their systems, because this upgrades every system in your body. And it's also for beauty, because what happens on the outside is just the same good that happens on the inside. So we talk about, you know, health from inside out and outside in. The wrinkles go away, the fatty adipose tissues go away, the age spots go away, the bald spots can get better. And we'll show you some pictures of that in just a minute. So there's a lot of things that happen. So we're down to the oral systemic promise, and we're going to talk about some of the issues that face us in clinical practice. And 75% of our medical costs are caused by chronic disease, says Michael Rosen at the Cleveland Clinic. And we know about the mind-body connection and the mouth-body connection, rather, and we know that everything that happens in the mouth, inflammatory-wise, can affect all these areas. So we're not talking about that today in detail. But what we are talking about is, what can a patient do to improve their general health, the resistance to the breakdown, the natural aging that happens just from living? Well, they can do all the things that we know. They can eat better, stop smoking, get better sleep. You know, sleep apnea treatment that we can do as dentists is very critical. Healthy habits like a personal trainer, you know, exercise definitely improves a lot of the biochemical, physiologic processes in the body. A sedentary person is going to be a lot less likely to live a long life than an active person. We can have regular dental care, and we know what that means. It means reducing the inflammatory burden on the body. That's the primary reason regular dental care is beneficial, is to remove the pathogens from the gingival tissues. And of course, redox signaling molecules is the one we're adding today to this lecture to stimulate your thinking to add this to your regimen for your patients, for yourself, because it's something you're not getting enough of now, and you can supplement that particular thing that's missing. The science of inflammation is really something that most dentists and dental hygienists understand pretty well. And we want to focus on a couple of areas about the portal of entry and the type of bacteria. So the portal of entry is always through the epithelium that is raw and not typically what we call normal epithelium. You know, it's an open portal. And the red bacteria complex is the one that causes many of the problems that go into the heart, go into the brain, go into the pancreas, etc. So these bacteria cause endotoxins and cytokines, and they speed up problems with the heart. They speed up problems in the rest of the body that can cause cancer and other things. What we want to do is see what can we do that we didn't know we could do before. Now, all these things can be associated right here on this slide with whole body inflammatory burden. And there's some things that we used to think were non-modifiable, which I will tell you now we can modify. The epigenetics of the body, we know how to do that now because redox signaling molecules actually turn on genes that used to be turned off. So if you've got a broken gene, a malfunctioning gene, if you supply it with enough redox signaling molecules, a lot of times they're going to reverse their inactivity and become active again to produce more of what they're supposed to. So it's an upregulation of genes that we're studying here and talking about today. The oral factors, removing the red and orange bacteria, particularly getting the oral biofilm to be a non-pathogenic type of bacterial growth in the mouth, because we're going to always have bacteria, but we want the pathogens that are the worst to be kept out of there. So these things we can do a lot. This person on the left has a lot of bacteria, and most likely a lot of the red and orange bacteria. They probably got some systemic diseases that are going along with that would be high risk for comorbidities, as we call it. It would be putting them in a really dangerous state. We know what comorbidity means these days, especially because the heart diseases and the diabetes and the obesities and metabolic syndrome that would be a precursor to being in the high-risk group for COVID right now is catching our attention. Somebody over here on the other side, though, the right side picture, beautiful, healthy gums, beautiful, healthy dentition, and that is something that is our goal. And that person has few comorbidities based on the oral condition anyway. So the status that we're looking for is microbiological stability, something that's not breaking down, that is not something that is a massive infective red bacteria. And the PG and the TF and the TD are the three that we're highlighting right there. The major goals of our periodontal therapy are really to promote a shift from a predominantly pathogenic microbiota to a host-compatible one the body can deal with without stimulating the inflammatory system. We want to stop that cascade of inflammatory products from going into the body, turning on the inflammatory reaction, the NFR2 pathway. These things that we are going to be studying a little bit later today are the ones that are the most important to stop. To achieve clinical and microbiological stability is our goal. It all goes along with the cardiovascular disease being the number one killer in the 100 years since we've been, measuring things, I guess you'd say, scientifically. Everything that's out there that we're seeing, how many people lose their lives every year, number one is always cardiovascular disease. It's 10 times more than most of the other things. So far, far more than influenza, far, far more than COVID, far, far more than even cancer. Cardiovascular is number one. And if you can eliminate the problems, the oral condition even will help it. So C-reactive protein is one way you measure total body inflammation. And one of the things I'm glad to share with you today is that my C-reactive protein was high for the last 20 years, and I never could find out why. I didn't have any active infections, and I was a little overweight, and so that in itself can cause the C-reactive protein to cause more inflammatory burden on the body. And so I thought that was the only thing it could have been. So I started taking the redox signaling molecules about a year and a half ago, and my latest blood test showed that my C-reactive protein was now normal. Went from 10 to 4.9. So I'm saying to you, you don't know what you've got because you don't feel it, but you can certainly measure it and test it, and you'll know. So those are some of the things that I'm finding out. The clinical predictive value of C-reactive protein really correlates heavily with the risk of future cardiovascular events like stroke or heart attack. So everybody should be tested and know your CRP levels. It's one of our goals. Same thing with diabetes, gum disease, diabetes connected, and we could screen those with the HbA1c blood test. And if that gets better, that means your blood glucoses are stabilized and better over a period of 3 months. That's the key of HbA1c, more valid than just a blood sugar level of 100 being, still considered a good one, 100 or less, but HbA1c is more accurate. There's another test I want to mention to you that's an arterial wall thickness study. You can do these scans in the arteries, and you can see if there's any calcium buildup. And one of the things that goes along with the calcium buildup is the oral bacteria getting caught in the plaque and getting caught in the arteries and starting what would be a blood clot that would block an artery, causing a stroke, a shutdown of the artery in the brain. So one of the things that we look for is the timeline of the arterial sclerosis. And as a dentist, our focus would be on P. gingivalis because it's been found to be histologically in the blood vessel that is blocked. You'll see a little P. gingivalis that started the plaque built up, and the body's reaction to that bacteria being in the arterial wall is to start laying down calcium and other fatty lipids on top of it. And it builds up and builds up, and it finally blocks the lumen of the blood vessel. That's why people have those coronary artery problems and the stroke problems in the brain, is because sometimes these P. gingivalis get in there and start an irritation to the inside wall of your arteries. And it gets built up thicker and thicker until it closes off and it shuts down the artery's blood flow. And a blood clot coming through right at that spot would be easily seen to block that thing, right? So here I am getting my blood, the artery test, the CIMT blood test, which is showing the flow of the blood through the arteries of your carotids. So basically you can do this in this screening test at a dental convention. And so I had mine done over 2 different years. And so it's kind of interesting to see the test, and both left and right sides were no plaque noted. I was happy with that, being that I'm 70 years old now, and my results showed that at age 63, my arterial age was 62. At age 69, last year, my artery age was 66, so I was aging slower than I was previously. That means that whatever I was doing was reducing the plaque and reducing the age. So that was redox signaling molecules and a better diet probably that resulted from that. Now, there's other people that take tests that have bacteria in their mouth, and they have a high red and orange bacteria. And what happens to those guys? They have a high reactive protein, 8.9. They have HbA1c that's somewhere, 4% is normal. This one was 7.4, so they're both high. And they have a lot of buildup in their plaques here, so they're aged in their arteries. So this is the thing we're looking for. And the message I have for everybody in dentistry is it's 2020, it's time for us to get aggressive. I feel like we've always been aggressive on periodontal disease, but just not to the level that we should or could be. There's so much more that we can do. So we can do the whole thing, but let's focus on getting the redox signaling built into our treatment plans. That's kind of the reason for the call for the seminar today, is look at how we can add things to our regimens instead of just doing the same old thing, because we're not going to get that much better until we do something new and better. So these guys down below, Vertus Norton and Tyler Norton, run a technology company that makes something that is just a a godsend. So they took what was said to be impossible and made it into reality. And Gary Samuelson is the guy that I mentioned who created this stabilized redox signaling molecule for us to use. It used to be known that it was very valuable, but they didn't know how to stabilize it because it was fleeting. It would go away within microseconds before it would be turning back to its natural state. And it was just the pure genius that allowed them to figure out how to stabilize it and make it useful for us in our clinical practice. So what is all this redox about? What really is redox signaling? Well, it involves oxidation reduction reaction in the cell. Each cell in our body has oxidation reduction going on, and one molecule will give up an electron to another molecule to make something happen. It's like the cellular telephone making a call. You call home, you say, I'm coming home for dinner, get me something ready to eat. I'm hungry. So, okay. When you get home, there'll be something to eat. Now, if you hadn't made the call, there might not have been something to eat. So the call is the important part. And redox signaling molecules are the signal, the call. And that's kind of the thing we're going to break it down into is how does that happen in the cell? Well, you know what rust is, oxidation. That's where iron and oxygen meet to become rust or iron oxide. In food, you get an apple, let it sit a while, and it oxidizes, and it turns into something that is ugly and brown. Well, it's just in the presence of oxygen. The polyphenol oxidase enzyme in the plant turns it into an oquinone, and that means that it turns brown. And if you actually put lemon on it, which is a reducing agent, then antioxidant, then you'll actually turn that process around and you won't get a brown apple. And that's what a lot of the people do in a grocery store is to keep their fruit looking fresh by having a little spray of lemon on there. So oxidative stress is not new to us. It's something that goes on all the time in our bodies. If we're aging, we're oxidizing. If we have inflammatory diseases, we're oxidizing. If we have cardiovascular disease, its reduction comes by oxidative stress on the vessels of our body. That is normal. And people that get Alzheimer's, people that get degenerating neural conditions, Parkinson's, all these different things, they have oxidative stress that causes these problems in their body. And so we're able to affect all these things in some way. If we can free up the free radical oxidative stress and make it less, then we're going to have problems that are reduced in each of these different parts of the body. Won't read them all, but just think about it. If you have somebody that's got asthma, if you got somebody with Alzheimer's, somebody with chronic inflammation, autoimmune disorders, got somebody with diabetes, different hormone problems, skin aging, everything that's listed there will get better if it were properly addressed early before it becomes clinical disease. So there's really two ways that are known right now to get more antioxidants in your body. One is to eat a bunch of plants like vitamin C, like cherries, like acai, berries and plants, and drink all the juices. There's a lot of people have been doing a lot of things like that, but what you notice is it takes a lot of plant to create the effectiveness because it's only 1-to-1. One molecule of plant goes in and neutralizes one bit of oxidation, the pollutants in the body. Well, there's a new process that you can use natural antioxidants made in your body or similar to those made in your body, and it's the redox signaling molecule. So these are made in the body from 4 different atoms, oxygen, hydrogen, chloride, and sodium. These atoms combine in different ways to become the cell signaling molecules that give away, donate electrons to the other different molecules in the body to make them go hither and yonder. And so they're not doing their job 1-to-1. They're doing their job 10 million to 1 per second. So it's a massive, huge increase in the number of actions that occur per cell. So I want you to think about how important people talk about antioxidants being and how much emphasis has been put on you should take antioxidants. And then look at what's happening inside your body by the natural antioxidants, which are known as several, but one of them is glutathione and the other one is SOD. Now, if these things are naturally occurring in your body and you could supplement them, then you would have a big benefit. And of course, that's what we're talking about is we could look at the mitochondria and we can see that these mitochondria go through the Krebs cycle, taking in glucose, and the output is energy. Those things we've known, we studied that in high school, in college, and dental school. We learned the Krebs cycle, and we learned the ATP, ADP, and how that works. But what we didn't learn, and this is new science, is that there was a waste product we thought made during the Krebs cycle. That waste product was called redox signaling molecules. It was a reactive oxygen species of molecules that we thought were waste. And now what we found is that those molecules are actually beneficial. They are critical in activating the repair process by producing redox molecules during the natural process of cellular respiration or Krebs cycle. Food is converted to cellular energy by getting us ATP, and the redox molecule are the critical product, not the byproduct, but they're the critical product of this cycle. They're more important than the ATP. So these redox molecules can do one of two things. They can act as antioxidants and they can be activators. They do two things. So they're like a shield to protect, and they're like an attack dog to go after bad things in the body. So when you've got enough of these, you've got things happening to activate the natural immune system. They activate vascular health and maintenance and arterial elasticity. They increase enzyme production. They make the hormone pathway active. They reduce the inflammation, and they enhance immunotolerance. So these happen on the drinking a liquid from the inside out, or you put on the skin and it goes from the outside in, and you'll get the result. How do they do that? The messenger of critical communication of nucleus to the cell membrane happens by this redox signaling molecule talking. So what's in the DNA nucleus needs to get out to the cell membrane to let something into the cell. I mean, a cell membrane is a portal, and it's got to be opened. For something to go through the cell membrane, redox signaling molecules are involved. If you don't have things going in or things going out, the waste products of a cell, the cell dies. So you have to have enough redox signaling molecules to keep life functioning. So this molecule is like sending a text that's directing proper interactions all over the cell. The first signal of an immune system to report a threat, for instance, is a redox molecule sending that text message. These molecules are secreted by a cell, and they initiate the inflammatory response from a white blood cell that got the message. So it's like it calls the cavalry to come and fight foreign bacteria or virus. Without the cell signal, the viruses aren't attacked. The body's not aware that they're there unless somebody tells the white blood cells to come running. So redox signaling molecules help cleanse the body. They play a key role in neutralizing toxins. They increase glutathione and SOD efficiency. See, the body makes these things normally, but when you have SOD without the proper amount of redox signaling molecules, it's not very active. And so redox signaling reactivates the SOD and the glutathione to make it more useful, more available. And so we're going to talk a lot about glutathione in the future because it is the key antioxidant in the whole body. They directly neutralize toxins and otherwise free radicals. But what about the detox? A lot of people that are taking redox signaling molecules will tell me, I feel worse. 10% of people that take it tell me right at the first of taking it, they go, oh, I feel worse. What's going on? Well, there's a detox reaction going on. That means you're dumping the poisons out of your body faster than your body can eliminate them. And so you get a kind of a resurgence of things through your system. Your body's just not excreting fast enough to get rid of them as your body's trying to clear them out. And so if your poisons are in your body, you got to get rid of them. You got to drink a lot of water. You got to reduce the amount of redox signaling molecules so you slow down the detox. Or what I tell people is this, you're going to get over it if you just keep doing it, so do it faster. So you can either feel bad for 2 days or you can feel, a little bit bad for a week. So detox and redox, 2 different things. They all relate to clearing the body of toxins and getting that free radical activity under control. Here's that feeling thing again, How many of you guys have these things? Do you have tired, itchy, dry eyes? Do you have foot and leg muscle cramps? Do you have a generalized weak immune system? Bleeding gums, that's one of the signs and symptoms of not having enough glutathione in your body. If you don't, periodontal literature is replete with studies that show lack of glutathione heavy in advanced periodontal disease cases. So why haven't you heard of redox signaling before, in the past? Well, the thing is, science moves at a very slow pace sometimes, although we're picking it up. We didn't even know about mitochondria until 1898, and genes until 1934. DNA, we didn't even know about the structure of DNA until 1953. So things are coming along. And in 1998, there was a Nobel Prize given to the people who discovered redox signaling molecules. There was a specific redox signaling molecule named nitric oxide that is commonly made in the cardiovascular system, and it causes the body to have reactions to certain things. And so it's a fairly new thing. And because of that, people started studying them highly in the next decade, and it wasn't possible to stabilize them that much. And people needed them, they wanted them, but they couldn't figure out how to harness them. So about 2010, though, there was a group that was doing research on this project, and they found out that if they took salt and water and they electrolyzed it and hold it in a tank and did some pressure and some heat, certain things to it, it could stabilize it and keep it in a bottle for up to 2 years, which was an amazing feat and one that has changed everything in the world of health and science and the epigenetic studies that are done supporting what's happening. They didn't know what was happening at first. They saw the miracles without knowing why, but now they know why. We're getting to the root cause of some of the problems that people have. And it's below the level of the cell, it's below the level of the cellular processes, like the Krebs cycle. It's below the level of genetics. It's into the epigenetics. It means it's a signaling that goes on between the DNA and the rest of the body to tell the cell what to create, what to make, when to send it, how to send it. Some people say, well, it's just salt and water, and on the bottle, if you pick up a bottle of it, it'll say salt and water, or sodium chloride and H2O are the 2 components of it. But what it doesn't tell you is that you have a broken down molecule that goes into the hypochlorites, the superoxides, the nitric oxide, the hydrogen peroxides, and 20 more different molecules. And so those are the actual things that are done in these tanks when they're making them. And each one is specifically doing something different in the cell. So when we say that it's redox signaling molecules, it's not one cell doing one thing. It's 20 reactive oxygen species. They each have a purpose. Each has a solution for the body. And so the body knows what it needs, and it uses these to do the job. So that's the important thing that you have to know, that we're basically replacing cell chemistry with more cell chemistry. What's missing is being added back. The redox signaling molecules are FDA approved, and a laboratory verified and certified that they're what they say they are. It's not just salt and water. They've done some double-blind studies to show that in a placebo with salt water versus redox sealing water is a totally different result. And so when it's made and bottled, you're able to tell a difference. When do we have the most of these? It's from infancy to puberty is when we have the most redox signaling. That's our growth period. And then after that, we're dying. After we get past puberty, we're not growing up, we're growing down. And we're losing 10% per decade of our redox signaling capability, which means our glutathione capability. And we need them both. We need to have these molecules. We need to have that antioxidant in our body. So as you get, 50, 60, 70, that means you've lost 70, 80% of your redox capability compared to when you were younger. That's why you're aged, decrepit, don't recover so fast. You can actually reverse aging with this. Things that are known to deplete redox signaling molecules are sun exposure, the pollution, the stress, the aging of just time itself as the molecules of the DNA just degenerate. And you get the mutations and whatnot. So how do you replace them? You just drink them, basically. It's my wife Sheila and Terry and I sampling some of that up in Utah, where we actually toured the factory to see the stuff being made. So let's talk a bit now about the injury, the actual problem. Everybody can understand that a splinter of something like that in your finger is going to hurt like the dog. And what happens is a cascade of events happens as soon as you pierce the skin. It breaks things and the cells start to spill. Inflammatory process starts, and there's a call to action by your redox signaling molecules to bring in the different phagocytes, and it goes after the bacteria that might have gotten into the splinter through the puncture wound. And things are just happening. In the mouth, it's a very similar thing as a splinter. It's a chronic inflammation that's calling the body to come and fight. And all the histamine reactions are occurring, all the phagocytes are coming. And one of the bad things that happens in the mouth, because it is chronic inflammation, is there's an overreaction and there's a destruction going on. And that's the danger of chronic inflammation, is destruction is going to take away the good parts of your body as well as fight the bacteria. So what we're looking at is trying to figure out, how do you stop the problem of the body fighting these lipopolysaccharide endotoxins that the bacteria generate? How do you stop it when it's chronic? And how do you guard against that happening in the future? The mitochondria, they build these free radical fighters, and they also attack the bacteria. So it's a shield and it's an attack. And so we need both, and we need them to happen the best way that it can happen. In a healthy cell, there's a balance between the different oxidants and the reductants. And so there's an even flow of the electrons back and forth. And the body really knows how to be well for the most part. But when you start having a lot of pollutants come in and you get out of balance, you have what's called a sick cell. The sick cell is out of balance with oxidative stress being too much. And the oxidative stress has to go to repair. And the only thing that allows it to repair are the redox signaling molecules, because it tells a cell to fix itself when it's broken. Or it may tell a cell to destroy itself and, die, so it can be repaired with a new cell, replaced with a new cell rather than keep the old broken cell. Here's a good analogy I like to show. You've got a normal situation in life where you've got a normal activity of a cell, like a house with a fireplace. There's a little smoke, there's a little dust coming out the top, and everything's under control. There's nothing problem going on. But when things get out of control, then you've got a massive amount of fire. It's heat, it's breakdown. You're going to lose the entire cell. The analogy would be to lose the whole body if it's not kept under control. So that's what happens in a cell. You got balanced redox, and then you've got unbalanced redox oxidation with hot spots all over. And so these hot spots can be seen in a microscope with fluorescence. Now, what happens with that, when a hot spot shows up, the normal body with good redox signaling molecule can make a phone call, a text message, some way to call the fire department to come and put out the fire and get the body back to normal before it turns into destruction of the whole house. So that's the reason and the way these redox signaling molecules work, is that they signal to get repair before the damage is severe. So what we want to do is we want to have a lot of these molecules around anytime we need them. And we're going to get antioxidant activation, and we're going to get improved gene expression as a result. The cell signaling allows cells to function the way they were designed to work. Now, what happens if we age? As we age, the genes are actually turning off. They're just wearing out, they're running down, their telomeres are breaking off, all kinds of things are happening. How can we turn them back on is the question. Anti-aging studies are being done, and they're showing on this study of cell death and disease at the University of Alabama, they showed this. Research shows that not only are mitochondria a key component in causes of symptoms of aging, but also in the symptoms of mitochondria causing that they can be reversed by reviving the mitochondria back to their original function. So if you don't have enough mitochondria, you don't have enough redox signaling molecules. You know, if you exercise, you get more mitochondria. That's one reason exercise is so important. And if the reversal happens by having better mitochondria, better signaling molecules, then everything in your body is going to be tip-top functional. There was a study done, released 2 years ago, that showed that redox affected 6 signaling pathway genes. There were 60 participants in the thing, 25 active, 25 placebo, and 10 control, where nothing was done. And so some got redox, some got salt water, and some got nothing. They found that the average age was a young group of 35-year-olds, okay? So these guys are not even depleted yet in their molecules. And so what does that show? And so what they showed was that gene expression profile changes as you take the redox signaling molecules. They took it for 8 weeks, and they were taking 4 ounces in the morning and 4 ounces in the afternoon or evening. So 8 ounces a day for 8 weeks. And so here we are, we've got 0 effect, and it went straight up over a period of 8 weeks with these 35-year-olds. Now, what were they studying? They were studying EGR1 and a bunch of others. So each one of these genes, they have a name, they express themselves better, 21 to 31% better, by taking the redox. People in the control, no better. People taking salt water, no better. Redox, 21 to 31% better. And so what we know is that these things work. They don't just have placebo effect. And so here's all the different parts, the additional pathways for the EGR1. So what I'm showing you here is that one gene, this is one gene out of the 6 that were studied, has another 15 different pathways that it affects. And look at all the different pathways: serotonin support, neuron and synapse support, NFR2, which is the antioxidant health we're going to talk about the most, vascular health, hormone modulation, insulin signaling, immune system support, and transcription, gene expression, how a DNA turns something into RNA, which turns it into protein. So all these things are going on at one time with one gene, and there's 5 more doing something else. And so it's an unlimited number of things going on that the redox signaling molecules actually help your body do. So here we go to the summary of what the gene study said. The defined mechanism of action for the redox signaling molecules is this: genes are expressed to change in their transcription abundance. That means more happens. gene activation and regulatory pathways that signal dozens of important biological functions. So it's many things, not just a few. No adverse changes were seen with gene expression with molecules or placebo, so that the material, the liquid, is completely non-toxic. Can't overdose. It's no unsafe amount. Redox supplementation offers stable expression changes. So as long as you're taking it, it's stable, it works. Then it reverts back to normal when you discontinue taking it. So whatever your body's doing, it's going to go back to what it was like if you stop taking it. The effects are systemic and they're non-specific to race, sex, or age. Everybody has results. Everybody. This always works. That's one of the things people don't really pay much attention to if they don't feel any different. They think it doesn't work. But, redox signaling always works because it's part of the natural process of the body. There was one interesting study done at the Human Performance Laboratory at Appalachian State University, and it was done on overweight patients, showing that they had a whole bunch of good things happen. There was a lot of oxidative stress when people were overweight, and they showed a whole bunch of things like decreased LDL and decreased serum cholesterol. But there were 43 metabolite shifts as soon as they started taking the Redox immediately, not after a week, not after a month, but immediately. They showed fatty acids were burned first, and then there was reduction of abdominal fat, and there was glycogen sparing, which means you don't burn your muscles up, you burn your fat instead. And this was especially important for athletes. It was a fat buster, a muscle saver. It aided in weight loss and cellulite reduction. So everybody should be interested in those things. Since we're Americans, we have to get rid of fat, and we need to get weight loss because the comorbidities of COVID, one of them is excess weight. So all good things can happen when you get rid of the weight. So what about dentistry? What is it about our profession that we could use this? Well, there's a couple of areas that I think are important. We'll talk about them. Killing bad bacteria is a selective biocide, so it works on the bad bacteria but doesn't kill all the good ones. It accelerates healing, so you can enhance cell function. And that's why I like it, especially because I'm seeing a lot of things that are beneficial to my patients. And look here, at all these things we could put in people's mouths and kill bacteria. We've been trying that for years. The thing is, this one's in the news right now, isn't it? All these things we use to kill bacteria in a root canal and a gingival sulcus, swish and swallow. No, most of them are swish and spit. So there's only a few things you could swallow that aren't harmful. Matter of fact, chlorhexidine is getting out of popularity because of some of the toxicities and some of the problems that are related to it. So here we are. We're probably getting away from chlorhexidine, and we probably should be getting more into redox signaling molecules because of some of the biocidal actions. And they did studies that showed that it is effective in 60 seconds against Candida albicans, Strep aureus, Pseudomonas aeruginosa, and Legionella. Everybody wants to get rid of Legionella if you got that. So we talk about oral uses, biocidal to pathogens, sparing the commensal good bacteria, elevates the glutathione, GHS, enhance healing, stem cell activators. It does activate your stem cells to work better. Is non-toxic, is anti-inflammatory. It makes the inflammatory process still goes on. The NFR2 pathway still goes on, but the other pathway, it's not going on. And so you got a really good benefit from not having the bad pathway of destructive inflammation in your body when you're actively using the redox signaling. It can be used topically on the skin and the gingiva and the mucosal tissue safely. Oral rinse is advisable actually to swallow it rather than spit it out because it benefits the body when it goes in. It's pH neutral, so that it's not dangerous acidic-wise. You can use it on the tooth. You can use it to disinfect, and you can use it on pulp tissues. You can use it on pre-post surgical sites. People with autoimmune disorders will have eruptions and lesions in their mouth that don't feel good. This can help the discomfort. You can help people with xerostomia to feel like they have more moisture by squirting and spraying it in the mouth. We use it for mucositis effects of people that have some treatments. If they're having side effects from their cancer treatments, this is good for the mucositis. People with injury and trauma do so well. I could just list a whole bunch of things that would be better. If you cut yourself, you burn yourself, sunburn, chemical burn, anything that injures the skin, this is going to help make it heal faster, better, less bleeding. You'll have bleeding stop immediately as soon as you put it on a cut, for instance. It's good for muscle and joint pain. You rub the gel over the joints, they're going to feel better. Good for periodontal disease and conditions. You can irrigate. We'll show some pictures of that. I love it for implantology to reduce the oxidative stress. You know, a lot of the implants that are lost are due to oxidative stress, and we can reduce that stress a great deal. 3 ways to apply the Redox. You always use plastic. You get the liquid, you got the gel. You can rinse with it, you can squirt it, you can put it on a gauze, you can put it in a syringe, just as long as it's not metal, because it's you don't want to have a ruining of the oxidative condition with metal ions. So here we are putting it on a lesion, putting it on a dry socket area. Here's some technique tips you can use, some little applicators, things that can put it on the gums, squirt it under the gums. You'd use it if you want for subgingival irrigation. I've seen some pictures. These are not my pictures, but I've seen these on the internet. So I've got some evidence-based work here showing there's some more bone in the case before and after. Before, after. You know, these teeth are regrowing bone around them, and that all the person said they were doing was the rinsing of the Redox. So interesting. I think we're going to need a lot of studies to follow that one up, see if that really does happen on a routine basis. You can rub it on the skin and have a lot more comfort. You can put it on the wounds and it'll stop bleeding. They'll heal faster. You can see that in my case here, I had an immediate load multi-implant case, and so I was taking out non-savable teeth, and you know, pretty bad case of root caries. Nothing was salvageable because there were 360 caries around the entire root of those teeth. So we ended up putting in some implants, some nice looking implants on top of that. And then sometimes I'll use this for all on 5, all on 4 cases where I'm going to put the patient preoperatively on redox signaling molecule so that they get their immune system built up, so they get their inflammatory system peaked out as good as it can be. So we had this patient in treatment for 4 hours and did his upper and lower, took out all his teeth on the top and crowned all his teeth on the bottom, and ended up with a complete mouth reconstruction, 12-unit bridge on bottom, splinted together, and turned out very nice. You know, immediately post-op, he came over about 30 days after the treatment, gave a testimony to people in my house that were there for a gathering, and he was talking all about how he didn't have any pain medicine at all, no narcotics at all. And so he was satisfied very highly, and I was satisfied. It's not the first one either that had no pain, had 6, 7 implants, no pain. And that's common. Not taking any narcotics either.
Okay, well, Dr. Williams just performed a major dental procedure on me, but about a month, maybe a month, 6 weeks, somewhere around
so he's
there.
He's there talking about it, and I'm not going to play that whole thing, but I just wanted to show you that this guy, right after getting all his teeth pulled out, is just doing wonderful. The oral systemic link is confirmed, you know, when we study the literature, we look for results and studied papers. This one really stood out to us. It was Pseudomonas aeruginosa bacteria, and they were studying it. We noticed it's related to blood clots causing heart attacks. That's one of the ones that that really we were mostly wanting to get rid of when we're doing our orange and red bacteria, right? And so the Redox research showed that this kills the organism, the Pseudomonas aeruginosa, in just 60 seconds. So kind of backs up what we're talking about as far as the benefits of using Redox for that kind of case. It's good for dry sockets. This dentist said that he been using it routinely for extractions. After extractions, for over 2 years, he'd been putting in the Redox gel on top of the extraction socket, and he had no post-op problems such as dry sockets or post-op infections. So that was kind of a good one. The most telling experience for me was after I had a difficult extraction of a lower second molar. The two dentists involved were inexperienced but keen, and the final efforts were very rough. It took a while to get it out, basically, and he had a dense bone. So the dentist had his own extraction done, took 2 hours. After a few moments, the clot formed, and he applied Redox gel to the site, and then he reapplied it a couple hours later. He had zero pain postoperatively after having rookie dentists basically work on him for 2 hours. And that's completely healed now, he said. That's pretty amazing. His lip and his cheek were a bit bruised and tender, but that was due to the efforts of the dentist levering on his lip as much as on the tooth. The Redox helped that to heal also. Another one said, just the other day I had to remove 1 in 32 wisdom teeth on a patient. I intended to save 31 with an endo. When I removed the old restoration, the caries went subcrestal on the lingual, so I had to extract that tooth also, a surgical extraction. Post-extraction, we irrigated all sockets with Redox liquid, put Redox gel in each socket, placed graft material in 31 and 32, sutured and replaced more Redox gel over the wounds before sending the patient home. He checked the patient, who was very tough to numb, even being sedated, and he feared they'd be a big baby post-op because of that. And the patient reported next day, zero pain, zero meds after the treatment. And the only thing they took at all was Decadron for inflammation. So pretty good, no narcotics. This is what has become the rule for his practice. This is Dr. McCartney down in Adel, Georgia. And he says also, my staff are big believers. So that's just some personal experiences people have had. A hygienist had a good turnaround on a patient. She said, I used Redox liquid for about 2 months before being in the dental hygiene. This is a patient saying this. I used Redox liquid for about 2 months before going to the dental hygienist. Then she didn't notice any big changes, but 6 months later, she asked me what I was doing differently, as it was like she was treating a whole different mouth than previously. I've always had an excessive plaque buildup due to overactive saliva glands, said the patient. But this time there was no plaque buildup at all, and my gum health was better than ever before. I'd used Redox gel as toothpaste for the last month of the previous 6, but I always hold that Redox in my mouth for about a minute before swallowing it. I'm very happy with this bonus health result. I think what the patient is saying is they don't have as much buildup and their gums are healthier, and it's an easier appointment. So it could be that that's related to this beautiful result of killing the bacteria off and not having the inflammation. I don't know about the calcium buildup on tartar or not. What we do know is that it supports systemic health. This is a pure oral systemic health play at its best. It's helping the body, it's helping the mouth. Here's one thing I use in my practice. It's a card that I've got. This is both sides of the same card. And it's letting the patient know how I have helped them when I give them a treatment that involves having a Redox dentistry liquid or gel. And so you can have something like that to kind of promote it in your practice if you want. And then when they read it, they'll go, oh, general health benefits too, huh? And if you want to talk about specific dental things, you can, or if you want to talk about specific medical things, you can. If you'd like to learn a lot more about this, you can go to RedoxDentistry.com. We have a manual you can download. We have a free manual, and we have a whole website there that's designed to support dentistry. So check that out. Everybody that's listening to this should go to RedoxDentistry.com and sign in, get a newsletter, get a manual downloaded, and it's all free. So we talked about dentistry. What about some of the medical things? A lot of these we don't treat in dentistry, of course. We're not treating negative attitudes. We're not treating poor hair texture, but these things happen. You need to know about them because, if you could impact all these things by changing one thing, would you? Would you actually engage in a discussion with patients about things that are not dentistry? Maybe you're not even in your dental office. Maybe you're just sitting around talking with your friends around the fire. And late one night, you're thinking about, the topic always turns to epigenetic modulation and, late at night, I'm sure at your house, like it does at mine. And you can talk about positive and negative gene expression. You can talk about toxicity, aging, environment, disease, drugs, stress, the microbiome. The microbiome is a huge important topic these days. What's the bacterial load in your body that you carry around? The billions of bacteria that live in your body. You need a biome. They're good for you. They do good things, but you don't want a bad biome. And so all these things y'all probably talk about. What if you could change one thing that would improve all of these? What if you could have an anti-aging, anti-toxicity, anti-stress situation going on with just one change? Well, that does happen. And when we do take the redox signaling molecules in, we improve our glutathione. And when we improve our glutathione, you get all kinds of situations better: immune, cancer, cardiovascular, neurological, thyroid, et cetera, et cetera. So just look at that slide and go, wow, I didn't know these things were connected to glutathione. I didn't know that you could enhance glutathione with redox signaling, but you can. So the most important molecule you need to stay healthy is called glutathione, says Mark Hyman, MD. Glutathione is found in every cell of the body. It's commonly referred to as the master antioxidant or mother of all antioxidants. We lose about 10 to 15% of our glutathione every decade, starting at age 20. Do you know why that is? It's because we lose our redox signaling capability, because the SOD and the glutathione are using the signaling molecules to get revved up, to do their job. That's the reason. 8 out of 10 people are hospitalized with chronic illness due to something related to glutathione deficiencies. That's a statement that you need to dig into and understand, because if you don't have enough of this, you're going to have chronic diseases. We listed a bunch of them, you could tell. If you have lots of glutathione in your blood and tissues, you live longer and better. If you don't, your functioning declines dramatically as you age and you die earlier. You must get your levels of glutathione up if you want to keep your youth and live longer. High blood levels of glutathione predict good health as you age and a long life. Low levels predict early disease and death. It's pretty clear that glutathione is a major antioxidant, the major antioxidant. Let's look at some people that have been given better glutathione, better redox signaling molecules, and see what happens to their face. Sunburn relief, almost immediately, within hours. Sometimes you got burns and they don't usually heal fast, but here we are with a gel in just 12 days. A 95-year-old guy. Old people don't heal so fast usually, but we're talking about putting something on those burns. Redox on the skin, gel on the skin, liquids drunk, and look at all the changes in the skin. Look at all the areas where this guy had some lesions here. Look at this cancer, this surgical site after the cancer surgery was done, and then the redox being taken enabled a very good scar elimination. And the Redox is a healer of skin and other organ tissues. Tremendous. Here's a friend of mine that Barbara discovered this huge melanoma. That's huge for melanoma. They went in surgery and took out a chunk, right? And so over a couple of months, you could see how much healing. Well, it wasn't healing so good over here. And he was complaining how it wasn't healing. Then he got some Redox gel and put on and started to fill in. And here we are 6 months later, and the hair is growing back on the head, and it's starting to get normal tissue. And, he's much better and has no recurrence. That's another thing. No recurrence sometimes is important. The ointment is working great on healing this hole in my head, he said, one of my friends. What about the respiratory system? Here's an interesting medical effect. I've had a baggie of 17 medications I'm off of for former serious heart condition, a serious lung and breathing condition, depression, a leg condition that kept me awake at night, and I'm off of a breathing machine and a mask I have used to wear to breathe while I slept. My doctors weaned me off as they saw my, what she called RR, redox results. And my cardiologist told me, I've never seen regenerated heart tissue like this. You need no further consultations. And that was 6 years ago, and I haven't seen him since. So this person got off of 17 medicines. What about autoimmune problems? This person had autoimmune challenges that cause the body to attack itself. There are many symptoms that are very debilitating, including skin problems, migraines, joint and muscle pain, extreme fatigue, and multiple environmental allergies. She was on the supplement 1 month. This has given me my life back, she said. Before and after pictures, you can see the face, the outside. The inside is just as affected. It has given me the quality of life back that I thought was never going to be there again, forever gone. I know that if I stop drinking it, I will return to that dark place. Going back is not an option. What about our leg and body pain? What about this one? 34 days after starting my journey drinking this amazing redox signaling supplement and using the company's topical gel, the same substance. Wow, I've got cholesterol down 31 points, glucose down 19 points, blood pressure below 120/70 most of the time. Night blindness gone, gum and tooth sensitivity gone. I see a good many patients with less sensitivity in their teeth. Energy level through the roof, no sleep aids needed for 34 days, more focus and clarity of thought. Sometimes it was hard to turn it off in the past. So blood things happen, you get better blood chemistry. I experienced that myself. What's the deal? Take it for 30 days? No. 60, no. 90, yes. Take it till it works. That's the key. It always works. Take it till it works. It's always tell patients, do the 90-day challenge. So you want to set the correct expectations for people. In a week, 10 or 15% of people are going to get a result. A month, maybe 30, 50%. 2 months, 70%, 80. It takes 3 months for 90% of the people to actually get a result that they can feel something different or know something different. So everybody's a little different depending on what problems they have. Here's what one patient said, what happens with redox use. I had battled a tick-borne illness for 8 years, undiagnosed for 5 before that. Symptoms started slowly but built up quickly. I went misdiagnosed for those 5 years, one doctor telling me it was all in my head. But I knew I was sick. I knew my body. I played sports all my life at a high level. It was pretty awful. Severe joint pain, brain fog, irritability, sluggishness, tingling in the extremities, dementia, all the symptoms. I started drinking 2 ounces 2 times a day. After 2 weeks of taking the redox signaling molecules, I felt suddenly like I was a bowling ball had been lifted from my brain. 4 weeks in, then many of the symptoms began to recede. I had better mental focus, better energy, better sleep, and my joint pain lessened. Now, 95% of my days are good days, and a bad day is usually just a little facial numbness, probably because my condition really attacked my nervous system. I'm in the gym 5 days a week. I run 5Ks regularly, and I finished a Spartan race in June. Redox signaling molecules allow me to live my life. P.S. I wrote this over a year ago, just finished my second Spartan race, and will be competing again in November. Flare-ups are very rare, and 99% of my days are fantastic. 1% are just great. If I had 1% of my days great, 99% fantastic, I'd be happy. How about you? This is a patient said, I have been on Effexor, a depression medication, for over 15 years. I thought in my mind that it was always going to have to be a part of my life. I've tried everything to get off this medication. Nothing worked. I'm 3 months now on Redox liquid, and I'm off all meds. Who would have ever thought that this little miracle in a bottle would be so amazing? My brain is finally happy. Yippee. Here's another one, medical effects, inside out and outside in. This is a lady taking 4 ounces of liquid daily. She applies the gel twice daily. This is what's happened in 2 months. The 2 pictures over on the left. Age 84, and there she is 7 weeks later. Now, 2 years later and 3 years later, she looks even younger because she kept doing it. And you can see that she's aging backwards and much healthier. Here's a good friend of mine, a nurse, who for 2 weeks put the gel on her leg, and the varicosities, the blue colors went away and just shrunk, looked better, you know. Here's a man that put this on his head, the gel, and in 9 weeks, he was getting quite a difference. Gel and liquid both, growing that hair. Here's somebody that really shows a dramatic effect of what the skin can do to reverse the aging and the damage from the sun and just time. So you can get beauty, you can get health, you just feel better all around. In just 3 weeks for that guy. Thousands of lives are being changed around the world, millions more in the future as people find out about this, as they learn about this. And each one of these pictures shows a dramatic change on the outside. And what you really know from this lecture is it's happening the same way on the inside. And so we really believe that it's from outside in and inside out that you're getting your health. I always have a question to ask people. It says, if you don't have time for your health today, when will you? You won't have health if you don't have time for it tomorrow. So think about that. Who is this for? It's for those who just want a better performance, better health, and better beauty. It's for everybody, really. Anybody who wants to be healthier should be looking at Redox signaling technology. It's going to improve your immune system, and we know what we need right now in our world today is we need better immune systems to avoid being subject to the attack by the viruses, bacteria, and things that are coming against us. Michael Ventura said it well. He said, there's no finish line, there's only mile markers. So life is not just something you live and stop, you know. You want to enjoy it all along the way. So my goal is to help you guys finish well, is to do your dental practice well, do your life well. So thank you for listening today. If you guys want to have a freebie, I've got a book I'll make available free to anybody who wants one. I wrote one called The $10,000 Day Dentist, which talks about how to create the perfect day and how to repeat it day after day after day. So you have great months and great years. And so what I want you to do is get a free copy by going to 10kway.com and download yourself a copy. And you can then figure out all kinds of things you can do that will help your practice and build your practice and make it more profitable. You can have more bonuses in your team. You can have more trips. We take our staff on a trip every year to a nice place so that we all go and do something together. So, you know, enjoy that free gift if you want it. And we invite you to improve your health by starting today. Unlock the potential you have. You know, I'm a teacher and instructor of dentists and dental teams, and I like seeing people do well. I like to help people. And this wellness concept of Redox signaling is just one new avenue that we found that works to help people. If it's been done, it's probably possible is one of my favorite sayings. If you want to read testimonials about people who have been helped by this kind of technology, if you want to read about people who had success teaching other people about it, then I'll be glad to share with you anything that you'd like to know. You can reach me again at Dr. Bill Williams down at that URL, and I'll be glad to connect with you guys. Any questions you have, I'm open to discuss it with anybody and everybody. It's just that much of a joy to support the dental profession, and you guys are the tops. Thanks so much for listening, and we will see you after the COVID is gone. We'll see you more often, and we'll give you all a hug. Thanks so much for being tuned in.